Hi everyone, welcome to Szenan-Balance Live. I'm Szenan from Szenan-Balance, the acupuncturist. Now, today's topic we're gonna talk about fibromyalgia. Now, we're gonna talk about what is fibromyalgia and what causes it and what's the risk factor for it. And in the end, we're gonna talk about um, what acupressure point or acupuncture point that will help relieve the pain from fibromyalgia, right? So this is the first live video that we changed it to. We normally do it at night time or in the afternoon, but I decided just move it to in the first thing in the morning, about 7 o'clock or uh, 7:30 or quarter past 7, something like that, and around of this time, but we'll fix it at 7 o'clock. Okay, so tomorrow we back to work, so we're gonna do 7 o'clock again for a live video every day. All right, so I hope you stick with me, and I'm gonna give you some information about your health. All right. So if you have any question or any topic that you would be interested to know about how to use acupressure point for it, please leave the comment down there and let me know what you suffer from, and I would like to help you with. Okay, let's start. What is fibromyalgia? So fibromyalgia is a long-term chronic condition, right? We all we all know this. You probably heard a lot about fibromyalgia, but do you know that fibromyalgia there is no scan or MRL to diagnose fibromyalgia? It can roll out other thing. Hi, happy day. So it causes pain in the muscle and bones. What is muscle and bones? Uh, there's a term of saying a word. It's called muscular skeletal, which you heard a lot about. Muscular skeletal means muscles and bone. So which means the pain in the muscle as well as bone. Right. The areas of tenderness. Right, it causes the tenderness that you can't touch it. Oh, it's painful when you touch it, you know. If you suffer from it, you know. But or if your family, your friends who suffer from fibromyalgia, you know, if you touch them, don't touch me, please don't touch me, because they do get pain from it, right? So of course, not everyone will be the same, but this is most of the time the fibromyalgia patient will tell you all this, right? And uh, general fatigue, they feel oh, no energy quite often every day, right? Sleep and cognitive disturbance, like not sleeping well, and the cognitive disturbance means that they um, what they have a lot of confusion, right? So this condition can be hard to understand, even of for the healthcare practitioner provider, because what happened is in the past they aren't given any good tool to tell to test that you have fibromyalgia. Um, all this symptom, and the healthcare practitioner it will think about are you made up all the pain is actually not there, you know. But when more and more people um, suffer from it, and more people complain about it, and they start real, oh, this is real. Some patient, when they test for MRI, X-ray, and you roll out all other pain, disease like arthritis or other chronic pain or immune system problem, inflammation, you can't you roll out everything, and then they still in pain, and they start to believe in fibromyalgia. So what are the symptoms? Okay, the symptoms. Um, Fibromyalgia cause what now refer to regions pain. A regions pain which means the pain is in the area rather than in one spot. Okay, rather in one spot. Okay, some of these regions overlap with what was previously referred to as areas of tenderness called trigger point or tender spot. So, which means um, if you've been to acupuncturist, we talk a lot about trigger point, right? And the massage therapies, they talk about a lot of trigger point. And they go to your body and they hit a point and they say, "Oh, this is very tight, and this is one of the trigger point." And they release the trigger point, and you feel better, all right? Because of the trigger point over here, the most sensitive one on that area, that getting very tight. Once you release it, the whole area release. The pain in the whole area release, which means the pain, the patient describes the pain, it won't be just in one point. It will be an area, let's say in this area, and it could be in this area, on both area. But when you release, you go to that area, you will find one point that is very sensitive than the others. Or the whole area is sensitive, but there is certain point on there that is very sensitive, the most sensitive one, and you release that point, the whole area will get released, and that called trigger point or tender spot. So, however, some of these previous noted area of tenderness has been excluded. Right, the the pain is this reason feel like a consistent dull ache. This consistent dull ache, right? Even though you release the trigger point, yeah, in this case, even if you release the trigger point, and the pain came back quite quick. And then if you go back to the trigger point may not be as bad, but the pain's still there. Yeah, that is fibromyalgia. And the fibromyalgia, in the past, your healthcare provider will consider a diagnosis of fibromyalgia if you have experienced muscular skeletal pain in 4 out of 5 reasons. 4 out of 5 reasons of pain outlined in 2016. They started to a new research came out and said, well, you don't have to go to. In the past, they have to diagnose fibromyalgia, and you have to find all the spots, and about 18 of them or more than that, and to be able to, they have to rule out all other issues. And then if you have still a lot of pain in the body in a different spot, about 18 or 14, something like that, and they start to give you, oh yeah, you have fibromyalgia. But now you don't need those. It's a different standard of diagnosis. And if you go to your healthcare provider, and they will be able to help you to roll it out for you. So let's talk about the other symptom of fibromyalgia. Okay, apart from pain, pain is the major one. It's the major one. And most people suffer from pain, and it's the obvious one, and most of the time it's the worst one, because they feel the pain 24 hours. The dull ache in there, right? And the pain really drag them down, take all the energy. Then they start to feel fatigue, no energy. Okay, no energy is another symptom of fibromyalgia. And of course, if you're in a lot of pain, and although you're very tired, low energy, but you can't go to bed, your sleeping is terrible, right? They can't go to bed properly, right? Sleeping for long period of time without feeling rest. Like you may go to sleep, like you can't sleep at nighttime, but until you had it, very, very tired, you knock off yourself, and once you go to sleep, you sleep for a long period, probably in the daytime, but when you get up, you feel restless, because of the pains they're still there, and you sleep on the wrong time. You sleep in the daytime instead of nighttime. Headaches is another common symptom for fibromyalgia, as well as depression and anxiety, because you don't know where the pain comes from, and you keep worrying about it and stress about all the pain. then yes, it will give you, it may cause you depression and anxiety. When you come to treatment and Western medicine side, it not just give you painkiller, it actually give you antidepressant, right? And yes, you have trouble focusing or paying attention, because you're low energy, you have pain, you can't focus properly. If you suffer from headache from it, then of course you can't focus properly, right? That makes sense. And dry eyes is another symptom, dry eyes, right? Then the pain or dull in the lower belly. The pain will be, most of the time will be on the neck, upper back, lower back, arm, legs, lower legs, even in your palm, your hand, and it can happen in the tummy as well. The belly, it can happen in there, and it the bladder problem that you may not be able to hold your urine properly, or some pain, discomfort over here. It may happen. Okay, not everyone get this. But it may. Okay, all right. Let's talk about the pain, the fibromyalgia pain that we talk about. It can go to chest pain, and of course, when it comes to chest pain, it can be sharp, stabbing, like a burning sensation. Then when that happens, we need to rule out, is it from the heart? Is it from the stomach? Because burning, it can be acid reflux, And when it comes to lower back pain, so it often comes to lower back as well. Then leg pain, and it can be deep burning and throbbing, throbbing pain, right? And let's talk about the fibromyalgia causes, right? Um, to be honest, no one know exactly what causes fibromyalgia, right? In the Western medicines, in the high arena, in the Western medicine, no one know about it, what causing it. But it's different in Chinese medicines, We talk about, hello, in Chinese medicine, we actually put it down to cold. And another term we call wind, and another term we call dampness, So what that means, okay, I'm gonna break it down to you. What that means, you may feel it if you suffer from fibromyalgia when the weather changed and it got worse, And people, if they live in an environment like, I don't know about you guys, in Hamilton, I live in New Zealand, in Dinsdale, Hamilton, and that is quite humid, right? That the dampness, if you put a dehydration, a machine in there, and you put it all day. I put it in my clinic, and within 2 days, the thing will all full. It comes with water, so in the ear there is a lot of dampness in the ear. So you can take it out and pour out the water and put it in and start it again. Again, it came out with a lot of water. So that's what we call dampness. So when the weather change to when it's raining a lot, the dampness quite, on the ear, and therefore that is one of the reasons that causing the pain. We call dampness in the muscle. And so in the organ, which organ out of balance that produce dampness and mucus, which means water retention things, one of the biggest organs that is stomach and spleen, So when stomach and spleen out of balance, then dampness occur in your body. Then the stomach and spleen control what? It control muscle. Well, we mentioned about the pain in fibromyalgia is actually in the muscles and as well as bone. So we call it musculoskeletal, right? So in the bone, the coldness linked to the kidney, linked to the water, and kidney control bone. Yeah? So when the cold attack the bone, and that is where the pain started, right? That's another reason here. And what is wind? The wind, I mean, you can see the wind, you can see the wind blow a tree, and the tree start to move, and the wind actually linked to the wood, the 5 elements, as well as linked to what? Linked to your liver and gallbladder. Then liver and gallbladder control joints, and control tendon, right? So tendon and fibromyalgia in the Western medicine, they didn't discuss about the tendons, but I will tell you what is tendons. Tendon is the muscle. We talk about muscle, right? And both end of the muscle. So this is the whole muscle. If we say, or this the arm, you can see. If think about this is the whole muscle, and the muscle is actually in the middle, and then both end and actually attach to the muscle. It's a whole thing. It's called tendons, right? So the whole muscle on both end is tendon, and here you got a lot of fiber and become muscle. And this area we call it controlled by stomach and spleen. And both end of the tendons is actually controlled by liver and gallbladder. So when we treat fibromyalgia, we actually need to improve the organs of liver, gallbladder, stomach, spleen, and kidney and bladder, right? Now, remember, we talked about fibromyalgia can affect the bladder region as well, right? This is because the coldness affect that, right? So this is just giving you an idea what in Chinese medicine the acupuncturist will treat you, how to diagnose according to Chinese medicines. That is what we do. We need to take your pulse and see your tongue and ask the question about it and see which one, where it come from, which organ related to it. Normally we treat all 3 organs, and normally most of the time for fibromyalgia, it actually come with the organs out of balance that I just mentioned, all the organs out of balance. Yeah. All right. Let's talk about, yes, a lot of people will think about fibromyalgia, and because in Western medicine, they don't know what's causing it. And one of the things that they talk about is infection. They may have infection, or it's actually run through the families, which is genes. But to be honest, I don't really. You need to realize this. In the Western medicine, when they don't know what's causing this problem, they always want to put down it's in your family. That's why we don't know what's going on. And they try to track the history. As I always mention, when it comes to family problem, and they say, well, it's in your family, it's in your genes. I would say that yes, it is. It's actually on the diet and on the things that how you react when things happening. If your father and mother eat this way, you eat this way. So that's why you suffer from it. So which means when they talk about families, you need to think about the diet. It's a lifestyle thing. You live that way. When things happen, you react that way. That's why all you are suffering the similar disease in your family, right? Does it make sense to you? Yeah. Trauma, like it can be emotional trauma, it can be physical trauma. You hurt it yourself, but you didn't get it fixed properly in the past, and that become chronic pain. And that is one of the reasons. Stress, yes, stress. There's a lot of people causing when they get fibromyalgia, they end up with as well as anxiety and depression. That is stress related, right? So stress is something that we need to think about it, right? Okay, treatment. Let's talk about treatment. Under treatment, yes, on the Western medicine, they don't have a thing for it. Really, the medication that they give is actually painkiller. Okay, so but if you know about the side effect of painkiller, okay, you won't want to take it. but they won't tell you about the side effects, you know. So, but you know, you need to go and Google and see what kind of side effects there, and then that's not good enough if you just know about the side effect of the drugs, you know, all the painkiller, and the painkiller often will be uh, what do you call it? Aspirins, ibuprofen, naproxen, or all these things. You know, it can control the pain, but you have to take it every day. Think about it. First thing, it ruins your stomach. You know, and we talk about in Chinese medicine just now. Um, one of the reasons that the pain in the muscle is because the stomach is being out of balance, and all this painkiller, the side effect is ruin your stomach. And we talked about in the past, it can cause bleeding in your stomach. Mm-hmm. It can cause bleeding in your stomach, and it's real thing. It's very real thing. Yeah, a lot of people have painkiller for a long time. They start to get bleeding in the stomach. You know, and yeah. So knowing the side effect of the drug is the first step. The next step, you're gonna find what else can you do in, you know, fibromyalgia natural remedies. Well, physical therapy, do some exercise. Yes, it helps. It definitely helps. Acupuncture. So acupuncture is another thing that acupuncture been proved and been using for 1,000 years that are good for pain relief. And not just that, acupuncture can help the organs restore the function that we just talked about, the spleen, kidney, and liver. Once you get spleen, kidney, liver function up, and they have more strength in the muscle and the tendon and the joint and the bone, then that's how we can help with fibromyalgia. And the fibromyalgia pain will get we live in very stable, and then we wear off the acupuncture treatment. All right. So acupuncture is one of the things, but of course, Chinese herbs as well. The Chinese herbs are the best for restoring the organs. Right. Then what happened in here? We know about the stress. You know, stress related. What can help stress? Meditation. If you're a meditation guy, hey, meditation is good. You know, but I'm not a meditation person. Okay, I do other things. We call emotional day practice in our clinic. I introduce to all my patients. It's actually called Ho'oponopono method. You know, you can search online if you wanted to. And yoga is one thing that it can help patients to relax, and this exercise can help the pain as well. But I do see my patients that sometimes after yoga they get worse. You know, so you really want to test it out rather than just uh, listen to it and just go for it. You know, this yoga it might good for some people, but it may not good for you. Okay? Unless you find a yoga tutor who really can adjust the move for you, okay? Rather than just, you know, go to the gym and everyone do the same. You know, if you like personal trainer, they can set up something for you to suit you. You know, or you go for a big class and you do some movement and you're gonna feel it yourself which yoga move are good for you and actually can help you relax and with less pain or fibromyalgia, and you're gonna figure out what move that after you do or while you do it gives you more pain, and you want to stop that when they do the yoga move. You know, so just take it slowly and step by step. You know, how can one balance spleen, kidney, stomach, and liver? Yeah, we will talk about it later. Okay, we'll talk about it later. Okay, and massage therapies and exercise and Tai Chi. Tai Chi is like a kung fu. You know, it's very good exercise. You know, it's slow. It's not like you have to run. Don't do running because running may not good for you. It's too much for you. So Tai Chi is very small, slow move, and it can help your blood flow into your body, and it's very gentle. Yes, Tai Chi is a very good thing, and of course, diet. And massage therapies, but I want to tell you, if you just do massage therapy, it's not good enough. Acupuncture, Chinese herbs are the best, a combination, because they can help your organs. Massage therapy, it can help you release the pain, but it just in the outside on the muscle, If your massage therapists know how to use the acupressure point to push it in there and to try to increase the organ function, that it's good, If you try the massage, you feel relief, and after a few days it keep coming back, then hey, for a few months you still do the same, you really want to try out acupuncture and Chinese herbs, right? Diet is important too, and here diet is very important, So what is the diet recommended? So if you go online, it will tell you, hey, eat fruits and vegetables along with whole grains, low fat dairy, and lean protein. And I actually don't agree with dairy. Animal protein, animal protein and animal fat. I don't agree with it at all. If you go for the China study, the great book of China study, is about diet, change of lifestyle. Diet is a huge thing for fibromyalgia, and people still suggesting dairy milk. Now, no dairy, no milk, because they have animal protein in there. It actually make the pain worse. It gives you inflammation. Drink plenty of water. We tell you drink plenty of water and eat more plants than meat. Yes, eat more plant, but no meat. Why? Because the meat will actually cause more pain. If you go to refer to the China study, the book, the China study, it will tell you all about it. It's all because about the animal protein, right? Reduce the amount of sugar in your diet. Yes, that's one big thing. Reduce the sugar. Reduce the sugar or no sugar at all. You should try it. And exercise as often as you can, like we just mentioned about yoga, Tai Chi, and go for a walk, not running, just walking. Be gentle of your body and keep the blood moving. When it comes to pain, no matter what pain, fibromyalgia or arthritis pain, I always ask patients, if you can move, keep moving, because you value yourself, and when you move, you think about, oh, you are still doing things. If you don't move, you're gonna put on weight, and what happened? The pain will get worse and worse and worse, because lack of circulation. Now, if you can keep working, you have some goal and keep going with that. And yes, another thing is weight. You need to keep your weight down. And it's easy to say to keep your weight down. If you're in a lot of pain, if you not exercise, it's hard to get your weight. Now, if you sleep all the time, so I encourage all my patients to keep moving, even you're on pain. Keep moving. Do the gentle exercise that you can do, and cut down meat on plant-based diet. Why is that? Because on a plant-based diet, you want to put on weight, difficult. On a meat diet, you want to put on weight easily. It's since you're in pain, you can't do a lot of exercise. You put on work, you can't go to work, and then diet is very, very important. Even though you can still go to work, diet is still very important. So you may find that certain food make your symptom worse, like such as gluten or MSG. Yeah, if in this case, we know what gluten is still plant-based, but some people actually get gluten. Is very sensitive to gluten. As soon as they get gluten, they have more pain. So in this case, keep a food diary. Write down what you eat, and then when the pain comes worse, and you're gonna check what you eat, you're gonna roll out what actually causing it. And then you're gonna stop the food of gluten, right? It can be others food. I don't know, but you can keep a food diary and figure out yourself. Because your doctor's not going to tell you. The doctor only give you a painkiller. you know. So we want to work with you. We can help you. Okay, we can help you. All right. Apart from that, let's talk about other treatment. You know, we talk about the treatment and we talk about the symptom, what causing it. In Chinese medicine, it's actually come with three organs, mainly stomach, uh, spleen, kidney, and liver, or all this stomach. How do all these organs? How do we actually give a treatment for it? It's simple for you for acupressure point, right? This first point, what we call it is uh, last mutation 4, right? Last mutation 4. How you get to the last mutation 4? Your fingers, your thumb, and here you can see the crease, and open your fingers like this and measure in there, and this is how you do it, you know. So her good point, level 4 are very good for pain, for headaches, you know. So this is just first point, right? Give it, how long do you give it to? For 1 minute, right? 1 minute, because the pain is all over your body, so you want to do it 1 minute. And the second one is actually on your foot, right? On your foot area, on the first big toe, between the big toe and the second toe, right? So if you put your this, if this is your foot, and this is big toe, second toe, and of course in here, right? This is on the liver meridian, so you can massage over there as well, right? So which is on this area, right? On this area, hope you can see it. First one, second one, and on here, right? On here, that is actually called level 3. I think it's level 3, right? Level 3. So that is open forehead. Very good on for pain, but there are two. It can cover all the entire body, meridian apart from two meridian. Those two meridian, one is UV meridian, one is Szenan meridian, which means UV meridian run through here, and a lot of people suffer from back pain. So I want to let you know that apart from that, you want to do this, okay, over here. So second and third, no, the fourth and the fifth. So go through here and find another point that is sensitive. Okay, it's gonna be very sensitive, right? So this is Szenan meridian. So use Szenan to balance Szenan if an acupuncturist. And what else? You want to come to here, over here, on the side. Hi Kika, hi Yunu, on the side of your little fingers here, on the side over here. So you're gonna go and do some acupressure point. Get the acupressure point over here. So you're gonna do here, here, and here, as well as here. When you do those 4 areas, get acid point, get sensitive point, and work on it, it can actually help your entire body pain. Entire body pain. This is based on balance method acupuncture. It can help all the entire body pain with all the meridian. When I say all meridian, what you can see over here, you know, all pain over here, the entire body. But the key is when you go to this area, you're gonna find from here to find a sensitive point. You know, if you get one sensitive point, you're gonna do that. If you get two, you're gonna do 2 points. If you have 3 or 4 points, you're gonna do all the points, as well as over here, right? And here as well, right? So if you can rewatch this live video and you're not sure about it, and you can pause the video and see how I actually go to the point, right? So on your legs, on your foot, same as if that's your foot, same as this area. You want to go from here to here, all the palm area, right? All the palm area, right? To get to the point. If there is just one sensitive point, do it just one for 1 minute. If there's 2 or 3 or 4, do all of the sensitive point, because it can cover the entire body, right? And those points, yes, it can help to improve the organs, which is you just mentioned about happy day, just mentioned about spleen, kidney, stomach, and liver. Yes, I just show you all the acupressure point and all the acupressure point that you can put needle in if you are an acupuncturist, right? It's so simple. It's so simple, right? So I make it so simple for you. I hope you can follow. Now I'm gonna do this live video every morning, okay, about 7 o'clock. So we've been over 35 minutes right now. So we keep it. Hopefully we can keep it for 30 minutes or just 15 minutes. So something like that. So stay awesome, and I love you all. Remember, if you're on Facebook, please click, give your thumbs up. On YouTube as well, give a thumbs up, and on Instagram as well, give you a thumbs up, and share this video, please. Share, click share. All right, I'll see you tomorrow morning. So stay awesome, and I love you all. Bye bye.